I think there's a couple of different things that'll be important to keep focusing on for future research in Alzheimer's disease. Obviously, as a sleep researcher, primarily, I think sleep is an important factor, but there's many important factors. And, one thing that we have to keep in mind is that Alzheimer's disease, just like aging, is a multifactorial problem. There are a lot of roads that lead to Alzheimer's disease, not just one. Now, it may be through the pathology. There's been a lot of focus on directly intervening in pathology with early trials to see if you can reduce onset or delay cognitive decline. I think those are important studies to do, and it's good that that's a factor that's important for the field. But something that's been a great success has been looking at modifiable lifestyle factors. If you improve cardiovascular health, you can reduce the incidence of dementia. So we've shown this. This has happened. Now that even though prevalence of Alzheimer's disease is increasing, its incidence is not increasing in the same way because we're targeting cardiovascular factors and improving health at a population level. So the same may work with other modifiable lifestyle factors too. Those related to sleep, those are other factors related to diet or exercise, other factors related to social engagement, things that can practically be implemented that are safe and cheap and scalable to a population level. I think these are important things to examine. In addition to that, a lot of research focus now has been on, can we intervene early and stop Alzheimer's before it starts, or develop some kind of vaccine? And once we've invented that vaccine, use it to kind of prevent people from getting it. But there's a lot of people now that have Alzheimer's disease or mild cognitive impairment or some form of cognitive dementia, and they can't be left out in the cold. And so we need to look also for treatments that'll slow the progression once you have it and help with symptoms, and that work to continue. But I really believe sleep is an important angle for this. It's been shown when people have Alzheimer's and when they have mild cognitive impairment, they are very likely to have sleep disorders, and treating that sleep disorder alongside their cognitive management can actually improve their cognitive symptoms. So treating it as an important feature for clinical care as well as a research focus, I think, is going to be really important. And really understanding why some of these modifiable lifestyle factors increase the risk for Alzheimer's disease. What are the mechanisms of that that explain why it's happening might give us new insight into new treatments to prevent it in the first place. So I think there's a lot of ways that we need to tackle this, but we need to treat this disease as if it's something that's not a simple single causal factor that causes a disease process to occur that causes dementia, because there's a lot of reasons why you might get it.